Okay, hey guys. So we're doing chapter 19. It's transport operations. This one's going to go pretty fast. Uh, I personally think it's a lot of common sense, but principles of safely operating ground ambulances, the risk and responsibilities of emergency response. Then we're going to talk about safe air medical operations, criteria for utilizing air medical response. So to be a effective EMR, you need to know the things we do. So we prepare for a call, we review dispatch information, we respond safely, perform our scene size up, we perform our initial patient assessment, we update other responders, and then we complete that post-run activity. And we're going to break those down. So preparing for the call, um, as first responders, you might have a bag like this. This is the exact bag I carry in my pickup. And you're going to have gloves, tapes, manual suction, 4x4s, ice packs, heat packs, all that good stuff, gauze, trauma stuff. Um, you need to just make sure things are in date. If you're on an ambulance, if you're on a service as an EMR, we do daily truck checks where we check everything in the truck. We make sure we have the right amount. We check the truck itself, tires, fluids, fuel, all that. So you want to ensure that your vehicle is ready and it's safe, lights are working. Be prepared to respond promptly using the most direct route available, and make sure you have the proper equipment to do that. So dispatch. So when we get dispatched, first off, dispatch is a center that citizens call to request medical assistance or fire or police. Um, most everywhere is 911 now. So the dispatchers are going to obtain like the name of the patient, their location, what the complaint is, um, services the caller believes are needed. So the nature of the call, location, number of patients, any specific problem, and then a callback number for either dispatch or even us to get a hold of them. So I'm going to reiterate, I've said it before in other classes or other videos that dispatch is only as good as the caller. So the caller, remember, is in a panic a lot of times, and they're not medically trained. So what they see and what they tell dispatch is what dispatch has to tell us. So that's why it's important that we are um, patient and understanding with our dispatchers. I have nothing but respect for dispatchers. So just keep that in mind that when you arrive on scene and it's different than what dispatch said, it's not their fault. Uh, So response to the scene. So get to the scene quickly but safely. If you're responding in a private vehicle, that doesn't mean you can run 90 down the highway. Um, you're no good to anybody if you're causing accidents or you're in an accident because now we have to respond to you as well. So we need to get there quickly but safely as possible. Consider traffic patterns and time of day, time of year. Around where I live, harvest is a terrible time to be a first responder because of all the combines and tractors and stuff on the highway. Uh, take into account like ice, rain, high winds, that kind of stuff. Always use your seatbelt. Keep all equipment secure. So, like in the back of the truck, we have everything in their cabinets in their place. Our oxygen tanks are secured in. Um, our monitor is in the monitor holder. Our jump bag is seat belted on the cot or seat belted on the jump seat. Um, use your warning devices according to state law. So you can run lights, but know your state law. Do not exceed a safe speed and drive defensively. You need to worry about everybody else on the road. Arriving at the scene, so place your vehicle in a safe location. You need to be remembering as you pull up to a scene, whether it's on the highway or at a residential house or whatever, you've got to be able to access that truck. You need other responders to be able to access the location. Um, when you get out, before you jump out of the vehicle, always check your mirrors, make sure that no oncoming traffic's coming. Perform a scene size up. So this happens as we're rolling up. Actually, this happens as we leave the base. When we start hearing dispatch, we should be forming our scene size up. So as we get there, though, we are looking at the entire surroundings. We're judging our safety and what equipment we might need to move the patient through the terrain or the area that we're in. Look for hazards, so down power lines, smoke, fire, ice, mud. Control the flow of traffic. So this is where I'm going to call PD, or I'm going to have fire assist with controlling traffic. Determine number of patients and need for additional resources. So if I don't have enough equipment or room on my one truck, then I'm going to go ahead and call for a second ambulance. And as a first responder, if you're not in an ambulance, you respond to a private vehicle and you walk in and there's three people laying there and all are critical, go ahead and call for that second or even third ambulance. Let dispatch know what you find and they can relay it to emergency responders. Provide patient care. So start find the worst patient if there's more than one, and we start down our list. We do our assessments. Um, that's why I hit on assessments so hard. Is we're going to go step by step. We're going to treat life threats. Then we're going to we're going to get our history, our vitals. We're going to do a secondary and treat those secondary injuries. Hopefully EMS arrives and you give a good report, which it'll talk about right here. So give a brief report of the situation. What'd you find? What'd you do? And how did they react? That's the main thing your report needs. If you've got the age, the name, the medications, the allergy, if you got all that, it's awesome. Baseline set of vitals, you're a rock star. But really, the cut dry, I need to know, what did you find when you got there? What did you do for them and how did they react to it? Um, then ask, hey, do you have questions for me? What can I do to help? Because as the advanced EMT, I might tell you, hey, I need you to stay in the truck with me. I need you to go ahead and get my IV stuff ready. Or, I might put you to work. Often to assist them in caring for the patient or offer to assist. So, hey, what can I do? That's kind of what we just talked about. Um, so you give that report. Um, you ask if they have any questions for you, and then you offer to help. Post-run activities. So EMRs really don't have paperwork unless there was an incident. You have to do like an incident report, or if there's abuse and you need to type up an incident report on that or something. But most of your run reports are done by EMTs or higher. Clean your equipment and replace needed supplies. So if you used up supplies, get them replaced. If you got supplies nasty, dirty, muddy, bloody, whatever, let's clean that stuff. Um, Only after you complete these activities should you resume regular duties or notify your dispatch that you are ready for another call. So this is kind of talking about if you're on the truck. We're going to go back to base. We're going to restock everything we used. Me personally, I keep a dry erase marker in the truck, and those dry erase markers you can write right on the walls, and then a sanding wipe will clean that dry erase marker off. So in my longer transports, I will write on the wall what I used. We get back to base. I take a picture with my phone. I go into the storeroom. I can grab everything I need and restock that truck and know I didn't miss anything. Once again, if we get equipment dirty, covered in grass, stickers, blood, vomit, whatever, we are going to clean before we actually go back into service. Um, so once we have restocked and we've recleaned that truck and everything's placed back where it should be, then we can notify dispatch that, hey, unit whatever is clear of scene and we're back in service. That just tells them that that unit's ready to roll for the next call. So helicopter operations, um, they're used by EMS systems to reach patients that can't be reached or to transport patients to a medical facility that are critical, remove patients from inaccessible areas. In the area that I live, our closest trauma center, big trauma center, is like 2.5, 3 hours away. So we utilize helicopters for a lot of things. Um, let's see here. Several advantages. They can respond quickly above the traffic and congestion and wilderness areas. They usually carry specialized equipment. Their personnel may be able to perform some advanced skills not available from personnel staffing on the ground. The bad side is helicopters are limited by weather, so foggy, stormy, they're not going to take off. Um, but a lot of times they are a lot higher trained and they can do higher skills. So know your local protocols and when it's appropriate to call those helicopters. If MS user uses a helicopter, so obtain a copy of the ground operation procedure, schedule an orientation session with helicopter personnel, which we did not do in this last EMR course, but um, I do have the connections and I've talked to the base manager. And in our upcoming EMT course, we will have that crew come in and give us a LZ class or a landing zone course. Know how to request a helicopter response, as well as what the criteria for calling a helicopter in trauma for trauma patients, medical patients, and wilderness responses are. So, once again, know your protocols. Um, I know in our particular area, that helicopter would rather be launched and be hovering over us than us wasting time on scene and then calling for them. So at the I listen to my dispatch and then I base it off what dispatch tells me. If it sounds critical, and I can get information, I'll have that helicopter hovering above me 5 minutes after I'm on scene. Um, and that's happened multiple times. And there have been times where I get there and I don't need them and I can cancel them and there's no problem. So just know your area and know your protocols. Helicopters can be dangerous to the untrained personnel. So the main rotor spins about 300 RPMs and maybe just 4 foot above the ground. So that main rotor is your front, the big rotor. Your tail rotor spins about 3,000 RPMs and may be invisible to the unwary person. So it spins so fast you can't see it. Rotors can generate winds of 60 to 80 mile an hour. So when they're coming in and they're taking off, we um, need to be prepared for that wind. Setting up that landing zone. So pilots usually land and take off into the wind. Most civilian helicopters need a landing zone of 100 to 100. Landing zone should be as flat as possible and free to breathe the best we can do. Setting up a landing zone. So we need to check for any nearby wires. If the site slopes or has any obstacles, notify that pilot. Know your local area, your protocols, and what radio station to tune in on to talk directly to that pilot or that crew. When making an area, avoid using flags, fuses, or flashing lights, and keep vehicles clear of that LZ. Um, so we don't want to put anything out there that can be either sucked into those rotors or blown away by those rotors. And we don't want to like use bright flashing lights, especially at night, because those pilots and crews use night vision and it is absolutely blinding to them. So loading the patient onto the helicopter. So secure all loose clothing, sheets, and instruments. Use eye protection. Approach the helicopter from the front and only after the pilot signals that it is safe. Follow flight crew's instructions. Give patient report to the crew away from the noise and offer your assistance. Um, Patients need to be packaged properly and secured. So on a lot of these cases, they're going to land that chopper and it's either they're going to land and shut down or they're going to do a hot load, which means they keep the chopper running. So the crew's going to get out and they're going to come to you. You give your report. I give report over the radio while they're still landing a lot of times. When they get there, I give them another verbal report. Usually they will do what they need to do with the patient in the back of the truck or on the scene. We will load them together. The crew will choose who or how many they want to go out to the chopper with them. So we walk towards the chopper and you'll stop and everybody looks at the pilot. The pilot will give a thumbs up and that means you're clear to come. You keep your head down, you approach the chopper and you just follow the flight crew's guidance. They'll tell you where to stand, what to do, how to load. If you've got extra people, we will stage. I use our fire department. I will stage people away from the helicopter, but they keep an eye and make sure nobody approaches it besides the crew. That way, we don't have someone walk into that back rotor or civilians trying to get too close. So having a lookout, one or two lookouts, is really good. So, guys, that's that chapter. Um, Which of the following is not a phase of the EMR call? So arriving at scene, that's part of it. The post-run activities, that's when we restock and we clean. Preparation, that's when we prepare our equipment, we make sure everything's good. So the one that we don't do as an EMR is scheduling for upcoming shifts. Information from dispatch should include all of the following except. So we need to know number of patients, nature of the call, and a callback number. We should know that nearest hospital. That's part of our job. So C is the answer there. And then when approaching a helicopter, you should always approach from the rear, always approach from the front, attempt to move the patient to the aircraft as soon as it lands, or not need for eye protection. So the answer there is going to be B, we approach from the front. One more thing real quick before I shut this down. If you're doing a hot load at a helicopter, make sure blankets are tied down and make sure there's nothing loose. And if you wear a hat, like I do, take that hat off before approaching that helicopter, toss it in the back of the ambulance, hand it to a firefighter or whatever, because the wind can actually suck this up in the rotor. And if something touches that helicopter, they're shut down. So keep that in mind. All right, guys, that was a simple one. Thank you, and I will see you on the next one.